Hey, I'm Dr. Rena, a urologist and pelvic surgeon, and welcome to my channel. Here you can learn everything you ever wanted to, and maybe never expected to, know about urology. Today, I'm going to explain what the color of your urine means. We'll talk about the different colors you might notice, and what each one could indicate, and also when it might be the right time to check in with your doctor. To begin with, urine is made up of about 95% water, while the remaining 5% includes substances such as sodium chloride, other electrolytes, urea, creatinine, and similar compounds. These substances contain pigments that give urine its yellow color. So, the normal color of urine is yellow. Let's go through the range of colors you might see. Number 1. Clear. What does it mean if your urine is completely clear? Usually, it means you are overhydrated. While this isn't usually a problem once in a while, constantly drinking too much water can sometimes lead to electrolyte imbalances. For example, it can lower the sodium level in your blood, which in some situations may cause serious health issues. So, if your urine is always very clear, you may want to slightly reduce how much you drink or speak with your doctor, especially if you feel like you're not drinking excessive amounts but your urine still looks consistently clear. Yellow. Yellow is the normal color of urine, but it can vary within a range. The shade you should aim for is a light, pale lemonade yellow. That color usually means you are drinking the right amount of water, your urine looks healthy, and it isn't overly concentrated. When urine becomes more concentrated, it may turn dark yellow or even amber. This usually means you are not drinking enough fluids. In that case, try increasing your fluid intake. Plain water is usually the best choice. If you're not a fan of plain water, you can add light flavorings. However, it's best to avoid drinking too many sugary beverages, since they can bring other health concerns. The next color you might notice is orange. Sometimes, orange urine can be a side effect of certain medications you may be taking. Some medications that I commonly prescribe include pyridium, which is often used for people who feel burning or pain when they urinate. One thing to know about this medication is that it can turn your urine bright orange. It can also stain almost anything it touches. If it gets on your underwear, you might notice an orange tint there as well. Orange urine can also happen because of other medications, such as sulfasalazine or certain laxatives that contain senna. If you are taking any of these, seeing an orange color in your urine may simply be a normal side effect of the medication. Diet can play a role too. If you eat a lot of orange-colored foods rich in beta-carotene, like carrots or sweet potatoes, your urine may develop a slight orange tint. For most of these situations, my general advice is simple. Drink plenty of fluids and see if the color improves. Often, the urine will return to a normal shade after some time. There are certain situations where concern is justified, but in many cases, orange urine by itself is not especially alarming. Another reason urine may appear orange is very concentrated urine. When you are not drinking enough water, the color can deepen and even take on an orange tone. Again, increasing your water intake can often help correct that. Now let's move on to red urine. This is the color that tends to worry people the most, because it can suggest blood in the urine. However, just like with other colors, there are foods and medications that can also cause urine to appear red. Certain foods, like beets, rhubarb, and blackberries, can give urine a reddish appearance. Some medications used to treat tuberculosis can also change the color of urine and sometimes even give the eyes a reddish tint. If you've recently eaten those foods or taken those medications, try drinking plenty of fluids and see if the color clears after a little time. But if the red color continues, it could indicate blood in the urine, and that is definitely a reason to see your doctor. In that case, we would first confirm whether there is actually blood in the urine. Then, we may perform what's called a hematuria workup. This usually starts with a urinalysis to check for blood or signs of infection, and sometimes a urine culture as well. We also look at the upper urinary tract using imaging, most often a CT scan of the abdomen with and without contrast. This helps us check for kidney cysts, masses, kidney stones, or any problems in the tubes that carry urine from the kidneys to the bladder. Finally, we may perform a cystoscopy. In this procedure, we use a small camera to look inside the bladder. This allows us to see if there are any stones, tumors, masses, or other abnormalities that might be causing the bleeding. During this exam, we also take a look at the prostate as well. We also check a serum PSA, which is a blood test used when screening for prostate cancer. I talked a little more about prostate cancer in another video, where I react to the Kaminsky method, so be sure to check that out. In that video, I explain what usually goes into prostate cancer screening and how those tests are used. These 3 tests together will usually help us determine whether there is something concerning that might be causing blood in the urine. Interestingly, we only find a clear cause in about 15% of patients, which means it's actually quite common for the test to come back without showing any serious problem. Even so, we always want to rule out important issues like cancer, kidney stones, or other abnormalities that could lead to bleeding in the urine. When blood has been present for a while, the urine can sometimes appear brown in color. Another situation to be aware of involves very intense exercise. If you've done something extremely strenuous, like running a very long distance or lifting very heavy weights, you could develop a condition called rhabdomyolysis. In this condition, muscle fibers begin to break down. It can be very serious. You might feel severe weakness in your legs, thighs, or shoulders, along with muscle pain, and you may notice that your urine turns brown. This is considered a medical emergency. If this happens, you should go to the emergency room right away. Treatment needs to start quickly to protect your kidneys, because untreated rhabdomyolysis can cause serious kidney damage. Now let's talk more about brown urine. Urine that looks brown or even Coca-Cola colored can sometimes be a sign of kidney or liver disease. If none of the situations we discussed earlier apply to you, or if the color doesn't improve, it's important to see your primary care doctor to make sure nothing more serious is going on. Certain substances can also cause brown urine. For example, taking too much Tylenol can sometimes lead to this color change. Next, let's discuss green or blue urine. This is quite uncommon, but it can happen. Certain foods, such as asparagus or blueberries, may occasionally give urine a slight green or bluish tint. There are also medications that can change urine color. In urology, during certain procedures, we sometimes use medications like indigo carmine, methylene blue, or fluorescein, and these can turn urine blue or green. There are also medications such as Urabel that may cause urine to appear slightly blue. Outside of urology, other medications can affect urine color as well. For example, propofol, which is commonly used during anesthesia, can sometimes change urine color. Another example is amitriptyline, an antidepressant that we also sometimes use in urology to treat a condition called interstitial cystitis. Now let's move on to cloudy urine. Cloudy urine can sometimes be a sign of a urinary tract infection, but it doesn't always mean that an infection is present. If cloudy urine is your only symptom, and you are not experiencing pain when urinating, fever, or lower abdominal discomfort, then it may not require treatment. If you are otherwise healthy and not pregnant, and you have no symptoms, it's usually best not to take antibiotics just for cloudy urine. However, there are exceptions. People with weakened immune systems, pregnant individuals, or those with certain medical conditions may need treatment. For most healthy individuals, the best first step is simply to drink plenty of water, which often helps clear the cloudiness. Finally, let's talk about foamy urine. Foamy urine can sometimes cause concern, but in many cases, it simply happens because you have a strong urine stream, which creates bubbles when the urine hits the toilet water. However, if the foaminess continues over several urinations, it's a good idea to see your urologist or primary care doctor. Persistent foamy urine can sometimes indicate protein in the urine, which may be related to kidney disease. In rare situations, it could also suggest another issue, such as a fistula, which is an abnormal connection between the bladder and another structure. I hope today's video helped you understand more about the different colors of urine and what they might mean for your health. If you have questions about this topic, feel free to leave them in the comments below. And if there are other urology topics you'd like me to cover on this channel, let me know. I upload new videos every day, so be sure to subscribe so you don't miss any of them. And remember, always take good care of yourself, because you truly deserve it.